Thank you very much. You can hear me and you can see the screen, I think. Yes. Okay. So what I would like to do today is to show you how PI-RADS work, the workstation, how PI-RADS with the workstation works. So what I did is I collected about 10 cases which I would like to review. And before I start, I would like to, well, give you a few clues in how you will perform PI-RADS reading. As you may know, PI-RADS is the structured way of looking at prostate MR images in order to detect a clinically significant prostate cancer. And the first thing you are going to do is to separate the peripheral zone from the transition zone. Why? Because in the peripheral zone, diffusion weighted imaging, that is the B1400 and the ADC image, is determining predominantly the score, the assessment score. So a 1 is a 1, a 2 with diffusion is a 2, a 4 is a 4, and a 5 is a 5. With a 3, you can get an upgrade to a 4 if contrast enhancement is early. And I will show that in the cases later on. When you have determined that a lesion is present in a transition zone, T2 is the dominant sequence. However, if you have a score of 2, then you may give an upgrade when your diffusion weighted image is a 4 or higher. And when you have a score of 3, you can make it into a 4 if the diffusion weighted image is a 5. I have asked you to download a book, a digital book, and actually this scheme is in this book. Also in the scheme there is the description in how to score with DCE, how to score the peripheral zone in T2, etc., etc. But I will come to that when I'm dealing with the cases. Okay, now let's start with the first case. And if you go to the book, you can go to a link, you say return, you go to the table of contents, you press case 101, and this actually for you without the images also is a learning experience. It shows you the lesion where we think is something there, and you're asked to fill in here the PI-RADS score, the assessment. Now, there are a few findings that we have described with some learning objectives. And if you want to have an answer, you click on the link to answer of case 101, and then you see the answer of the case with a description, with pathology, follow-up imaging, etc., etc., and a learning objective. At the end, you can go back to return and you are back at case 101 again. Now let's start with case 101. This is a 50-year-old man and he has possible prostate cancer. He's concerned and his urologist because his PSA is 21. What we do is we always determine the prostate volume. Nowadays, this is being done by segmentation, but also you can measure the prostate anterior, posterior, left, right, and CC times 0.53. And there you have the volume. Well, this is important because you are always correlating the PSA to the prostate volume when you read prostate images. You can calculate in this way the so-called PSA density. PSA divided by the volume. And when this exceeds 0.15 or a little bit higher, 0.20, you should be very concerned because there usually is a lesion. So this for me is one of the clues in how what the risk is that the patient has cancer. When you have, for example, a very big prostate, your PSA can be 10 because still your PSA density can be very low. And I will show you a case later on. In this patient, the PSA density is far too high, and the question is there a tumor? Now, let's look at the images. Here you see the workstation, and I will try to make it a little bit bigger. I hope it works. No, not really. Okay. Yep, I do it this way. So on the top left, you see the T2. In the middle, you see the B1400, the calculated B1400. Here you see the contrast series, and you can click on the button here, then you see the start of enhancement. This is what I do right now. So what I'm always doing is I look at the early enhancement. This is the first enhancement in this patient. You can see the arteries start to enhance over here and over there, and there's enhancement of a lesion. Now on the lower left, that is the sagittal image. The lower right is the coronal image, and in the middle it's the the ADC. So the fusion in the middle, and you see this prostate now. Now what I usually do is I zoom out and I'm looking at the surroundings of the prostate, because I want to find, for example, a bladder cancer or a rectal cancer or lymph nodes or whatever. So the first thing I do is I look at, for example, the sagittal image. Here it is. And I click through the image from one side to the other side and back again. I look at the bladder. This is the urethral cyst. This is a normal finding for the bladder, by the way. You see the intraureteric ridge. You see the rectum. There's no rectal cancer. Bladder is okay, and there are no lymph nodes in the obturator region. So now we go to the prostate. And for the prostate, you can look at the prostate in several ways. You can look at the T2 and go through it from the bottom, which is called the apex, to the top, where you finally see the seminal vesicles. You see here the bladder, seminal vesicles. I go down. Then you are in the prostate. This is the transition zone. Dorsally, it's the peripheral zone. And you go down, down, and once of a sudden you see a lesion over here. And then what you can do is you can look at the lesion and look at the other images, how this looks like. Now, if you want to do a fast reading of prostate MRI, I always start in using the ADC image. So I'm using the B1400, and this is for me usually like a light bulb. I look at the images and I see a white area here. This white area corresponds with a very low ADC, 613. You can read the ADC value by clicking on the area. It's even lower, it's 520. So this is an area. Where is it located? That's the first question. Well, it is the peripheral zone over here. This is the normal peripheral zone. And it is here the normal peripheral zone, and the lesion is quite large. It's over here. And this is the normal peripheral zone on the other side. So this is a lesion in the peripheral zone. And for a peripheral zone lesion, the most important sequence is diffusion. Now it's focal white on ADC, on B1400. It's focal black with a low ADC value of 520. Normal with most machines is around 950. This is far too low. So this is either a 4 or a 5 on diffusion. Now you can look at the lesion size and you can actually measure it. You can make the anterior posterior measurement, which is 12 millimeters, and here it's 8. And now look at CC, which is 19. Well, this exceeds 15, and if it's larger than 15 millimeters, it is a 5. So this lesion is, according to measurement and according to focal abnormality on diffusion, a 5 on diffusion. It's a focal lesion on T2 over here. This is the sagittal image, coronal image. So it's a 5 as well. And it shows early enhancement here on DCE. So the score is 5, 5 plus, which gives a final score of PI-RADS 5. So the assessment is 5. Now let's look at the results. What I'm showing in the book is that you can calculate the B1400 and higher from your normal sequence. We are using a sequence of B50, B500 and B800, and from this we calculate the B1400 and the B1600 and B2000 and 5000. So actually here is what I'm showing. Now the lesion is exceeding 50 millimeters, so go to the answer and you see 5 plus, and this indeed is a cancer. Also in this patient a PSMA scan was performed, and you can see a hot spot on the side where the tumor is. And this patient was given radiotherapy. Now there was something which actually in my enthusiasm I didn't look quite well. And I said that you have to look at all the images and all the prostate. If you find one lesion, you need to find perhaps another one. Just one thing to the organizers, I'm seeing only the chat of the breakout room and not the chats and the possible questions of the audience. So can you please give me a clue how to do that? Okay, I will continue. What actually needs to be done is you need to have a very good view of everything. So let's go to this one, and now there must be something else which I didn't see. You see the structure over here? Let's have a look. This structure over here is in the presacral and in the perirectal region. And this is a positive lymph node. It's too large. So this is very important to see, because now you see a PI-RADS 5 tumor with a possible positive lymph node. And there is something else, is that if you see one lesion, try to find other lesions as well. So let's make the journey by the B1400. I go upwards. And now once of a sudden I see here a white lesion, which is focal black. So this is a 4, and another lesion over here, white and focal black. This is also a 4, a PI-RADS 4. ADC value is 569, it's too low. And this corresponds with a focal area on the T2 and an early enhancement. So beside the PI-RADS 5, there are 2 PI-RADS 4 lesions. And there is a lymph node positive. And as you can see on the PSMA scan, that is why I re-looked at the images, there is a positive lymph node as well. And this patient was given radiotherapy in combination with hormonal therapy. I want to ask the organizers how to look at the chats of everybody. So please give me a clue. I will continue with the next case. Let's go to this one. So I will close this one. Now, this patient is a 60-year-old man with the question, my PSA is a little bit elevated, 6.6. Do I have a prostate cancer? Now, his prostate volume is rather small, it's 39. and he has a PSA density of 0.18. Now let's look at the images. Here we have the images again, and let's first look at the T2, at the surroundings of the prostate. Nothing in the area, no positive lymph nodes, a normal bladder with a little bit hypertrophy of the bladder wall. It's a little bit too thick. That's usually what you have in a 68-year-old man. No lymph nodes, no rectal cancer. So what I'm going to do then is to zoom in on the images. That's what I usually do. I zoom in. And the other thing is that I try to window and center the B1400 correctly. So let's try to do that. Now this is the correct window and centering. Zoom in a bit again, and let's have a look in what is going on this patient. I will just walk through the patient, and all of a sudden you see the light bulb again. It's easy, isn't it? It's over here. It's in the middle, and you can see it also on the T2 weighted image. You can see a lesion over here. And then the question arises, where is this lesion located? The peripheral zone at the apex is merging anteriorly. And actually this lesion is either in between the left peripheral zone anterior horn or the right. And the question is this a transition zone tumor or arterial fibromuscular stroma or peripheral zone? For that, you have to look at the other images. So let's go to the lesion. The lesion is over here. You can see the lesion over there. And this is a large lesion. What is important is that it's black and white. And let's look at enhancement. It enhances earlier than the rest. Now, if this is a lesion in the peripheral zone, it's black and white, it's a PI-RADS 4. And if it's in the transition zone, you should look at the features of the T2. Well, for T2, I have the advice, look with a magnification view, perhaps even more magnified than what I had already. And what you can see is here is organized chaos of the transition zone. And here you have more or less homogeneous intermediate signal intensity without a margin around it. When you have intermediate signal intensity and erased, I call this erased charcoal, it is a 4 or a 5 when it's large. So let's go back to the images. T2 4 on this WI. It is also 4, and here you see enhancement, early enhancement. And what I finally would like to emphasize is you don't need sophisticated pharmacokinetic software. The only thing what you do is you look at the enhancement image. So just look at the enhancement loop. And you can see that even centrally there is washout. Wash in, wash out. Now, when you have a transition zone lesion like this, with pathologic enhancement, you can be sure that it is a very aggressive tumor. So, I will come to the end of this second patient, and I think also at the end of my workshop. And I would like to show you the results of this patient. There were no signs of extraprostatic disease. So this is a 4 and a plus, which yields a 4. And on biopsy, it was a Gleason 4+3 and a 4+4 with cribriform growth. So this is a very aggressive one. This patient had a prostatectomy. There were no positive lymph nodes. He had an aggressive tumor. 4+4 is 8. So thanks to MRI, this tumor was found. And the patient had the appropriate therapy, which was removal of the prostate, and up to now he is very healthy. I think with this I'm at the end of my talk. I have many more cases to show. However, I only have half an hour. Be my guest and look at the other 10 cases. They are self-explaining. So despite the fact that I couldn't show them, I hope that you will enjoy it. So thank you very much for your attention. I'm going to look in how to assess the questions. So after the next workshop, I will be back with you for the questions. Thank you very much.